Cockley, our Chief Clinical Officer, and Dr. Jennifer Frank, our Chief Medical Officer. Thank you both for being with us today. We are talking vaccines, an exciting milestone. We had a Facebook Live a few weeks ago, and now we want to follow up on some of those conversations and questions that we are seeing now that the vaccine availability has been opened up to more community members. So appreciate both of you joining us today. And we are really looking for follower questions. So please, if you have a question for Dr. Frank or Dr. Cockley, ask it in the comments. I am monitoring those, and we will get to as many as we possibly can. And please know that we will be monitoring those comments even after the Facebook Live ends. So keep commenting and we will get back to you just as quickly as we can. But again, your participation is very much encouraged here. All right, so let's just start off first of all with Dr. Cockley. Can you give us an update of where we're at right now with vaccines? What does the process look like? And now that we've added more community members in, what's kind of taking place?
Yeah, thank you, Cassandra. Yeah, definitely. So really the process we're doing now, and know everyone has heard initially that the first 1A group is to immunize those skilled nursing facilities and those high risk of severe illness and mortality, along with maintaining the infrastructure of healthcare delivery. And that's what we've been doing over the last 4 weeks here, since really just before Christmas, rolling that out. We're in the process of finishing up the second doses for a majority of the healthcare workers and those as we're going, but also reaching out and working with the Department of Health of bringing in those other healthcare workers that may not necessarily be associated with the hospital for the work they do, and bringing that in. Plus the other aspect of the health department has instructed about police officers, fire departments, pastors, ministers, those type of things in our 1A group. Then as of last week on Monday, we were then authorized to start doing vaccinations for our population in general, but those over 65 years of age. And really in that process, what we want to do again is help reduce that severe illness and risk of mortality. People that get admitted to the hospital may not have a good outcome if they get infected with COVID. And really looking at the mortality and those risks are people that are over 70 years of age or have more increasing medical conditions, whether they have lung disease, heart disease, kidney disease, things like that. So really looking at the risk stratifying tool and trying to get the first doses focused on them. Knowing we have limited doses coming in from the state, how do we deploy those out to that very critical need of people that are high risk for severe disease or mortality from committing COVID? And now we're starting in our second week of that and continue to roll those out as we go and have availability of vaccine.
And Dr. Frank, this is a question that we get so often. You're hearing it from your patients. We're getting it on social media. People want to know when it will be their turn. And it's an absolutely valid question. We are trying to get to as many people as possible. So can you explain what that process looks like of, just getting to as many people as we can, and then how they get notified for that?
Of course. So as Dr. Cockley mentioned, we're really trying to prioritize who is most likely to get ill or become adversely affected if they got COVID. And so that we've been following the DHS and the CDC guidance as to who should get vaccinated first. As that has happened, we have gradually increased the number of people who get an invitation electronically to get a vaccination. And even though it can be very frustrating not to have gotten that invitation yet, please know that we are doing this very thoughtfully. We are doing it in compliance with guidelines. We are, for most patients, we are issuing kind of an invitation to get a vaccine through my chart or my ThedaCare, which anyone can sign up for. You don't have to be a ThedaCare patient, and you will get a notification that it is your turn. You'll have the opportunity to sign up electronically for an appointment at a number of different facilities, whatever works best for you as far as date, time, and location. We will continue to release those orders in a phased approach based on our availability. Usually the availability of appointments is not the problem, it's the availability of vaccine. And so every week when we get our vaccine allotment, we have a good idea of what we're going to be able to do for the following week. And that's similar to what public health and community sites are seeing as well.
Oh, thank you, Dr. Frank, for mentioning that.
We don't know.
Yes, exactly. That's a really good point that I'm hoping that we can really have a great conversation about here. And that's what this forum is for, to help, people better understand kind of what we're experiencing from a health system and how this is being rolled out. Because it's confusing at times for people. So again, taking comments from people, we have lots of questions coming in so far. But Dr. Frank, I want to go back to what you discussed too, about that we sort of just don't know what we're going to get until, up to the minute. Dr. Cockley, can you talk through that, about what it's like getting those doses in, and kind of what we're receiving at this point?
Yeah, so great points from Dr. Frank and from you, Cassandra, that we on Monday and by Tuesday noon fill out a survey of what vaccines we could distribute in the following week. We submit that to the state, and they go through their process of basing on how many immunizations they get in and where they can deploy those out to. And we find out on Friday noonish, Friday afternoon. Last week it was until about 5 o'clock we found out what we're getting for the next week. So at that point in time, we can then open up our schedules to know, yes, we have vaccine available, we have staffing and facility available, and we could administer those. So what our goal is to be able to do is be able to administer as many vaccines as they give us. Our target will be to get to 10,000 vaccines a week. So if we would get that, so some of that is we need to accommodate at least 5,000 people of first vaccine, but majority of people have to come back in that 3 to 4 weeks to get that second dose. So kind of in 2 to 3 or about 4 weeks after that first go live last week, we want to be up to 10,000 doses a week, but then be able to scale down if we only get 1,000 doses, like we did last Friday. We were allotted 1,000 doses. So it does not take a lot of time for those to fill up. Again, using those orders that are released and the invitations in the MyChart for those people that are at increased risk. I think today we are releasing another 5,000 to 6,000 orders based on to use up the rest of the vaccines that we have, and get prepared for orders being out there when we get that shipment in and we can open those up. So the availability is there, and go from there. But it is a little bit kind of as much frustration on our side as it is for the patients, because we want to get it out, because we want to help keep people healthy, keep them out of the hospital for something we can prevent, but not knowing what we get and making it easy for people. Obviously we have the electronic outreaches in MyChart, and how can we work at other ways to get notifications to people, respond to them, to get them signed up. Right now, if we have last 2 weeks, if we had some times where we had 5 or 10 open spots, we have lists of people that have that invitation, that we have people that can call out and schedule people to make sure every day is as full as possible, so no vaccine is waiting for someone.
Thank you for bringing that up, Dr. Cockley. I do have some questions coming in from Tracy and Barbara, who have sort of asked that same question. The elderly who may not have computer access or MyChart access, why it's so important to have your phone number, your information up to date within your chart and with your primary care provider. Because like you said, if we have those vaccine slots available, we would then do outreach to those patients, correct?
Correct. So a couple things we're doing to help with that. So yes, we are sending out invitation orders and people that have MyChart active, but even people who meet those risk stratifications, we are still placing that order in their Epic record. So if they would activate their MyChart at a later date, then that order would still be there so they could go in and sign up. And then looking at how do we then reach out to others in different ways to get them scheduled. Again, if we have that list, we have work queues that show who have an order. And if a specific site has 10 openings and they need to fill them, they'll look at that work queue, who has an order, and they can reach out to them. And trying to build that as we go. The issue is that we have over 70,000 people in our region that meet that 65 and older. It's very time consuming to do 70,000 calls out to people to get people scheduled and continue the regular business of people that need to come in for their regular medical conditions. So that's the importance of having that MyChart, that automatic activity that people can go in. Over the last month, 19,000 people activated MyChart accounts throughout the region here in our Epic instance. So significantly more than normal. And there were over 50,000 more people logging into their MyChart to look. So that process is working. People are going in there. I think it's about the average was about 5 or 6 times each to make sure they have the order, are they due, can they sign up? So it is working. And then how do we roll that out to everyone else? And then people who don't have the technology continue to work on a process to call them, get them in as we can, and continue moving through that.
Thank you for giving us just a bit more insight into that. We're trying to do our very best to get to as many patients as we possibly can. Let's go back just a bit here. Dr. Frank, I want to talk a little bit just about the vaccines in general. You know, now we're sort of seeing more people becoming vaccinated. Can you tell us just, you know, what the process is? Because it's 2 doses for either that you're receiving right now. Can you just talk us through what that's like to be vaccinated, what potential side effects are, and then what you can expect? Because as more people, again, are being able to be vaccinated, I think they're going to have those questions. And there is a little bit of apprehension with this.
Absolutely. So it's very similar to the flu shot as far as how it is given, where it is given, and even how it feels to receive. So we have vaccination clinics that are set up, which means you wouldn't necessarily get it in conjunction with a doctor's visit like you might for most vaccinations. You'll have a dedicated clinic that you go to get the vaccine. When you come in, you'll just let them know that you're there. You'll already be registered in the computer, and they will ask you a series of questions. These are questions that are released by the Centers for Disease Control, and they're to identify if you have any conditions that might need additional attention prior to getting the vaccine. And these include questions like, are you pregnant or breastfeeding? Do you have a bleeding problem? Things like that. There are very few contraindications to getting the vaccine. One that may be common is if you have a fever. We generally recommend you wait till the fever is done, but most other medical conditions, it is safe to get the immunization. Part of the reason we ask those questions is sometimes we will observe people for a longer period of time just to make sure that they don't have any reactions. Once you sit down, you get the vaccine. It takes all of 3 seconds. It's usually given in the upper arm into the muscle. And then we have you wait for 15 minutes for most people. Some people, we ask them to wait for 30 minutes if they're at increased risk for an allergic reaction. And during that period of time, we're just wanted to keep an eye on you and see if you have any symptoms that would indicate a serious reaction. Those types of symptoms would be breaking out in hives, difficulty breathing, what we call anaphylaxis. Some people do have reactions such as passing out or feeling woozy. Those are pretty common with all vaccines. And that also gives us an opportunity to evaluate people and then make sure that they get the care that they need. After your 15 minutes is over, then you just check out and you will leave with your appointment for your second vaccine. If you get the Moderna vaccine, that will be 4 weeks later. If it's Pfizer, it will be 3 weeks later. If you go past those dates by a few days, it's not a big deal. Nothing needs to be restarted or anything like that. Side effects are fairly common, and the most common, of course, is having a sore arm where you got the immunization. Most of the time that lasts for a couple of days at most, usually does not prevent you from limiting that arm, but it might be sore to roll over in bed, for example, and lean on it. Other side effects that are commonly reported include things like fevers, sometimes 101, 102, that usually occurs within the first 24 hours. Some people report joint aches or muscle aches, headaches. You can get a rash or redness at the site. Those are the most common side effects. Serious side effects are very rare. And again, the one that we get most concerned about is a true allergic reaction that occurs shortly after getting the vaccine. When you have a reaction, it usually is going to start within 12 to 24 hours if you have a side effect, and then it usually is gone within 48. It's much better than having COVID.
Yes, very much so. Okay, so these are all great points. So a question for you, Dr. Frank, that we received from Barbara here. She's asking that I believe that there have been recommendations that if you've had a vaccine within the last 30 days, should you get your COVID vaccine if you are eligible? Can you talk us through that?
Yeah, I mean, one of the things that unfortunately I think people are sick of hearing us say, and we're sick of saying, is we don't know. So our recommendations are based on our best available knowledge, based on the information we have for these vaccines. So we don't exactly know what the true reaction would be if you had had a vaccine, but generally we recommend no vaccines within 14 days before or after your COVID vaccines. You should certainly confer with your doctor to find out what your prioritization is, but as a very general rule, COVID is usually going to be the highest priority vaccine you receive. So for example, with my patients who may need a few different vaccines, I'm advising them to get the COVID vaccine series completed first, and then we will get to their other vaccines.
Okay, thank you for talking us through that. I want to also get to the different variants that we're seeing right now of the virus. I again taking questions from followers here. We're trying to get to as many as possible. There's some really great ones coming in. We will get to those. But Dr. Frank or Dr. Cockley, whoever feels more comfortable answering, can you explain, does the vaccine cover these new strains that we're beginning to see pop up across the country?
Well, I'll start off with, and Dr. Frank can assist. So, we truly, again, don't know all the significance of this. And really what it is the vaccine is a process for your body to produce the spike protein of the virus. And that's how the virus attaches in your body and creates infection. So by your body making that spike protein, it can produce antibodies to fight against that. And as long as that spike protein keeps its specific configuration enough that your antibodies that you produce can recognize that spike protein, there still will be some protection for it. Now, as that spike protein starts to change a little bit, that antibody may not connect as firmly, as quickly, so it may allow you to develop some symptoms, but the theory is that it will still provide some protection. And that's some of the information about the Johnson & Johnson, which was studied in South Africa, is that there was more of that South African mutation there. And is that why the Johnson & Johnson was only 67 or 70% effective, where the others were 94%? Still 67 is significantly good infection, knowing that some of the others like influenza is a little over 50. So it still is good protection. The other thing it did show that it did prevent hospitalization, did significantly reduce severe disease, and that's really what we're looking at. Yes, you still may have some cold symptoms, cough, runny nose, that, which you could spread it, so we need to be careful with that. But also it does prevent and protect you from the severe disease, which is the key. And I don't think there's any evidence yet that shows that any of the variants that this isn't happening, but it is being closely monitored throughout. One of the best ways to help protect us, though, is for people to get vaccinated now to prevent the virus spreading in our communities, because the more that virus spreads, the more it replicates, the more chance it can develop other mutations, which then could lead to that risk of decreased protection from the virus. So it is important to do that and continue your masking, your hand washing, again, also to help prevent the spread.
One way that I heard it described, and this is from the University of Waterloo, so I can't take credit for this, but is that when you are having a vaccination, like the COVID vaccine, what it's really doing in your body is kind of putting up most wanted posters, right? It's putting a picture of this criminal or this most wanted all over your body. So all of the antibodies would recognize it right away and take it out. The variant would be akin to all of a sudden that picture having a mustache or having a different hair color. It's pretty similar. So it's going to work pretty well. It may not be perfect, but it's similar enough that, as Dr. Cockley mentioned, we're very confident that the most serious side effects or most serious adverse effects of coronavirus would not be present.
Oh, that is a great comparison for us. Thank you for sharing that, Dr. Frank. That's a really good comparison. Most wanted poster with just some changes to physical or features that give it a little different feel. So very good comparison. Thank you for that. Okay, we do have questions coming in. So Dr. Frank, I want to ask you one here. Susan is wondering if she can get the vaccine if she had COVID last month.
So the recommendation is that you can get the COVID vaccine if you are completely clinically recovered. You are at pretty low risk of having a reinfection within about 90 days, possibly even longer after COVID infection. So you're not necessarily high priority to get it for that reason. But yes, if you've clinically recovered, the CDC says you can go ahead and get that series.
Thank you for answering that for Susan there. I also have some questions coming in about the next groups. So we have this 1B group, and we've seen recommendations of who will be in this next group. So Janice is wondering, does that include retail workers, people at the grocery store, others who might be in that essential worker category? So Dr. Frank, Dr. Cockley, not sure who wants to tackle that one, but can you kind of explain about where we go next with those groups?
So next with our groups, it is basically done by the disease management out of the Department of Health, and they produced some initial comments on here's what is likely to be in that next group and what it involves. And it does list many of those that you mentioned, Cassandra. But again, we still have to kind of wait till that time before we really officially say, here's who we're going, because just before they said go to 65 and older, that group a week ahead of time was completely different. It was 70 and older, and it had some of these other infrastructure workers in it, and they changed. So I think it's still a little bit of a fluid situation. The thought is, yes, those critical infrastructure workers that will be coming up in that next group, and the tentative date is March 1st. But I think some of that depends on how we get through this current group, the 65 and older that are higher risk based on the number of vaccines that are available. If we get more vaccines and we can say we've gotten 80% of the 65 and older or a majority of people who want it, it may make it easier to transition to that next group. But if we're the state's only getting 20,000 vaccines a week and we have 700,000 people to get through, and we're not even a third through that 65 and older group, it may delay that or alter that transition. So the best thing is, keep up with the news, keep looking and see when your time is coming up, what those current recommendations are, and then we'll keep moving through it. Again, it also could depend a little bit of the state on how bad the viral infections. Do we start seeing increases in the community with the variants and that, which may alter our process too. But be patient, your time is coming. We know that you're out there and we want to get you vaccinated as quick as possible.
Perfect. Thank you, Dr. Cockley. Linda is wondering, for people who are generally healthy under the age of 65, what does that timeline look like? And I know, Dr. Cockley, you kind of talked about that. It sort of depends on what's coming with the state, but people are, wondering where they are in line here. What does it look like before this is kind of opened up to the general public of, if you haven't got your vaccine yet, now it's time for you?
Yeah, I think that it's up in the air. What I see and what I've heard, it's summer. It's late spring, early summer that will probably get to everybody being open. But again, it does, depending on how much Pfizer and Moderna can ramp up, how quickly the Johnson can come online, and is there another one after that? I think there's a lot. If the Johnson numbers look good and it continues to be a single dose vaccine, that could really help roll that out to more people. Because doing that second dose, really, after you get 3 or 4 weeks into it and have another volume coming back, it does limit that rollout because you're doing a second dose. So more that comes in, that's a single dose, the higher dose supply. But we're trying to be there to be able to administer as many as we can get to help out and partner with the Department of Health, the local Appleton Health Department, to work with them so we can service the community as quickly as possible.
Good things for us to keep in mind here. Dr. Frank, I have a question from Barb. She wants to know, if you've had COVID, do you only need one vaccine or do you need both vaccines?
That's a great question. And again, it's I don't know, because we really don't fully understand how antibodies after a natural infection work, how effective they are, even how to measure them to make sure that we understand that. So the recommendation would be to complete the entire series. What we don't know is, are the antibodies you particularly produced from your COVID infection going to be as good as the immunization, which is very, very effective? Because we don't know that, we want you to be fully immunized with both shots, for example, if you get Moderna or Pfizer vaccines. The other thing is that there's no harm to you from getting a second vaccine. You're not going to get sick from the vaccine. You, again, could potentially have side effects, but it's not going to be dangerous for you to get that just because you have the COVID infection. If anything, it's going to enhance your natural immunity.
I'm seeing a lot of questions just on social media and moms groups that I'm in. They're wondering, is this vaccine going to be available for children coming up at any time soon? We're really focused on this adult population, but what's for children and when does that happen?
I think we're still waiting for that. Again, I think as we're going, we're still early on in the proof. Obviously we went through all the steps we needed to approve this, but again, there's different subpopulations that they're continuing to go on and investigate, do the trials and get that. So I would imagine that is coming soon. I haven't seen a specific timeline for that. I think it's reassuring that for the majority of children that get infected, the disease is more mild. and they don't seem to be able to don't transmit it as much, which is kind of counterintuitive because we figure that, a lot of times when colds go around schools and homes, they get transferred easily. But I think we still know, and really it's concerning that there are a few that still get that severe disease, and we want to make sure we're preventing that. And then their exposures, it's still going to be a few weeks probably before we know a specific timeline.
And I think that's a good place for us just to talk about what we should all be doing right now until this vaccine is available to more community members. What are the things, Dr. Frank, that we should continue at this point and the precautions?
So that's a great question, because I think people wonder, I myself wonder, well, how protected am I? What do I have to do differently once I'm fully vaccinated? And the answer is that you need to do all the same things that we've been saying for the last year. You need to continue to wear a mask. You need to continue to wash hands, socially distance, avoid close gatherings, all of those same things that we've talked about. And that is because we're not sure whether you can get either a mild form of the infection or whether you can carry the virus in your nose and then spread it to other people. And so it's still important that you do everything you can to minimize the risk of exposure to COVID. And then certainly for those around you, making sure you're keeping them safe. So unfortunately, at this point, no changes yet.
Okay. Thank you. And I have a question coming in from Cindy. I've also heard this too. She said that her mother received the first vaccine a few weeks ago, felt fine, but she's hearing that the second dose tends to create those side effects and make people feel a little bit worse after the vaccine. Dr. Frank or Dr. Cockley, have you heard any of that? Is there something to be said for the second vaccine creating more side effects? Anything to that account?
Yeah, I can start off here. Yes, I've heard that also. And part of it is just the process. If you think about it, that first immunization, it's new to your body. You haven't had exposure to it. So it does ramp up your immune cells, start producing antibody. You get memory cells that provide some protection. But the purpose of the booster shot is then to build upon that. So now you get the booster shot. You do have some immune cells that are used to that, can recognize it, see that most wanted poster, and then start producing more cells and duplicate and produce a larger and stronger response, one to recognize that infection, and then also to produce more memory cells. So you do get a little bit more of that inflammatory response that gives you those symptoms. I've also heard that people who've had COVID priorly, because so they have some of those antibodies there, they have some of those immune cells, when they get that first dose, they have more of the symptoms kind of like that second dose of others. But some of the earlier studies are showing that if you've had the infection and you get both the boosters, both the vaccines, you do have a little bit even higher immune, antibody response. So that's part of the process, and I think that's similar to other vaccines. I know when I received my shingles vaccine, that second one was even more response 30 days later, just because your body's ready for it.
Thank you, Dr. Cockley. Question here from Linda. Again, we appreciate these comments coming in. This is really good interaction. Thank you all very much for participating. Again, keep these comments coming in. We'll keep asking Dr. Cockley and Dr. Frank these questions. This is your opportunity to have time with them. I have a really interesting question here from Barbara. She says she has, for family visiting and maybe wintering in like summer states, should those people be getting the vaccines in those states that they're in now, or should they wait to receive the vaccine when they come home for spring or summertime?
I would get the vaccine as soon as you can from anyone willing to give it to you, as long as they're a reputable healthcare provider. But there's no benefit to waiting to get it here. They're getting the same product we are.
Very good. Yes. And I have a question here from Janice. She wants to know, and this again, maybe a question that we just don't know the answer to right now, but I'm still going to ask it. Dr. Frank, will this become an annual vaccine, just like we see with influenza?
We don't know, of course. I think that the common thinking is a coronavirus is the kind of virus that causes colds. And what we know is you probably had more than one cold in your lifetime. And then we also know that there are variants that are subtly changing the way that spike protein looks, similar to how influenza changes from year to year, how it looks. My guess, my best guess is that we will probably have a booster at some period, whether that's after a year or after 2 years, potentially at some point in the future, maybe even combined with the flu shot. That's my suspicion based on what we know about coronavirus and how it behaves.
Okay, good to know there. Lots of good questions coming in. I think these are all kind of things that we're thinking in the back of our minds too. And now this is an opportunity to ask. Dr. Cockley, we have Linda who is wondering how long and how much of the population needs to be vaccinated before we can stop wearing masks and stop social distancing. I know this is probably the question that you are hearing most often, but how long is it going to be, and how many people need to be vaccinated before we can stop and go back to whatever sense of normalcy or new normalcy it's going to be?
Yeah, Linda, that's a great question. I think the more the better. And, I think some of it is a couple of different fold that you have to look at. One is, where do we get to the point where it's not rapidly spreading throughout the community? Right now, if we get, say, 50% of the people are vaccinated, that means if you have the infection, only half the people you come into contact to, you can spread it. So that will slow down the spread. So one of it is how many people have to be vaccinated so we can slow down the spread. But even if you're 80% vaccinated, that could leave 20% of the population vulnerable. And depending on their health conditions, they still could be at risk for severe complications and hospitalization. So I don't know if we know specifically if it's 80%, if it's 70%. Really, we won't overwhelm the health systems if we have 70 or 80% immunized, but there still could be pockets of people at risk of significant disease. So I think for the time being, and as Dr. Frank said, probably throughout this year and probably in the next, there is good reasons to continue wearing masks, continue wearing, washing your hands and distancing, and really being careful after you've been in social environments where more people are gathering, because the more people around, more likely someone may have the infection with mild symptoms that could spread it to you and you take it home to family. So it is a little bit of a loaded question. I think we still probably need to look at continuing this for a while, and really looking at some of our influenza numbers this year really significantly decreased, and almost no influenza season this year because of what we're doing for coronavirus. And now, obviously, that spread the same way: respiratory, contact, hands, doorknobs, those type of things. So doing this work of wearing a mask and hand washing really can significantly improve the health of the community. So it will be something we'll continue until we know for sure we can stop. And that's probably the best time, but it's an unknown date at this time.
I think, Cassandra, I wanted to just add as well that, right now we're seeing a little bit of a skewed view. A lot of people want the vaccine and there's not enough to go around. But if you look at the national surveys, 70 to 80% of the population is not reporting that they're willing to get the vaccine. And so that concerns me. And I want to make sure that everyone in our community understands that, again, just like the flu shot, it doesn't just benefit you, it benefits everyone around you. And so I would encourage people, if you have questions, if you have concerns, even if you're not in line for the vaccine yet, go to reputable sites, talk to your doctor, talk to people who are knowledgeable about this, so that you can understand the vaccine and hopefully get to the point where you are comfortable getting it. Because even if half of us get it, it's not going to be as powerful as it could be if many, many more of us get it.
Oh, those are great points to make. We see all of these messages, and you're getting questions from your patients saying, when is it my turn? When can I get it? But those are the people who are really wanting the vaccine. And you're right, we're not taking into account the others who may be hesitant or have more questions. But absolutely, like you said, those are those conversations to have now before you are eligible, so you can do your homework, feel like you're informed, and make that best decision for you and our communities as a whole. Because you're right, it does impact others as well. So thank you, Dr. Frank. Very good point to make there. I have a question from Sandy. She's asking, if you have COVID and you don't know and you get the vaccine, can you be harmed in that way?
No.
That's a simple answer. I like that, Dr. Frank. Thank you for that. But that's good to know, because like we've talked about so often, people may not even know that they have the virus and they may get signed up for the vaccine. So good question to have. I also have a question that we've seen in the news recently, Tylenol before or after getting the vaccine. Can you provide some insight there about what that recommendation is?
So go ahead.
No, go ahead, Dr. Frank.
I don't have a great answer. So if you do, please jump in.
It's probably the same as yours, so go ahead first.
I would say that I'll tell you what I did is I did prophylactically take ibuprofen both times I got the immunization, just to reduce the likelihood of a fever as well as that arm pain. What I've also heard anecdotally is that it may not work as well as it typically does if you have a fever. So I would probably, you have two choices. One is you can get it beforehand, and that's typically what we've done with kiddos, but what we know from pediatrics is that's actually really not that helpful. So my recommendation, based on what we know from pediatric reactions to vaccinations, is to treat an actual symptom. If you're sore, if you don't, if you have a fever, if you have a headache, treat it with your usual either Tylenol or ibuprofen, but don't take it before the vaccine in case of something happening.
Yeah, I would agree. And, I think some of the things with anti-inflammatories, there's some theoretical aspect that, the purpose of the vaccine is to cause some inflammation, cause your immune system. Now you're putting anti-inflammatory in there to suppress that. Some theoretically that it could impair it. I don't know if there's any good data to suggest it. But again, like Dr. Frank says, it may not be any benefit to do it anyways. It's better off to wait till you start having some symptoms, treat it afterwards, because you may not need it. So
All right, good recommendations there. Like I said, we've seen this in the news pretty frequently, so it's good for us to address it here. Again, taking questions from our followers here. Wonderful conversation and discussion going on. We appreciate that. Again, keep them coming in, and I'll get to as many as we possibly can. I have just some questions here. Knowing that Super Bowl Sunday is coming up, Dr. Cockley, what are we asking people to kind of be aware of in the back of their mind as they're, every year we plan these Super Bowl parties and we have friends and family come over, but this year it should look different. So can you give us some guidance?
Yeah, I think it probably this year needs to be a household thing that, hey, you have the Super Bowl, you watch it with your family members, people you spend in that, with together in that house all the time. Really, because you get in an environment, if it's people you don't know, you're, having some beverages, you have food, you're sharing utensils, you're yelling and screaming at the game. So it is a little bit higher risk of transmitting if one would have some mild symptoms or even be asymptomatic. So really, I think, for the most part, it probably is going to be, hey, let's enjoy it at home with immediate family members and do that this year. Enjoy the commercials, do whatever you need to enjoy it with your social unit. If you do happen to, be in a larger group, I think then be very cautious afterwards. If you want to wear, wearing masks while you're there could be good. You could have your Kansas City Chief or your Tampa Bay Buccaneers scarf on, and that could help protect you there. And monitor your symptoms afterwards and know that, hey, I need to be on alert for the next 14 days that could I have been exposed. Make sure that if you do get it, you're not then going to transmit it to your coworkers, your other family in the grocery store, that you make sure you're following good protocols afterwards. So be my recommendations.
Okay, good recommendations there. Dr. Frank, I have a question for you. You've done a few media interviews regarding this topic, but while we have you, I think we should discuss it as well here. Double masking, again, something we're seeing in the media frequently right now being discussed. Can you provide some recommendations or your thoughts behind double masking and what we're hearing?
Sure. This is actually the topic of conversation around our dinner table last night, and we were kind of talking with our kids about it. So the idea, of course, with a single mask is that you're blocking your ability to transmit virus to other people and their ability to transmit virus to you. And just like we recommend that any mask you're using is either a medical grade mask or has that double layer of protection, possibly even with a filter, the more of a barrier between you and kind of the outside world, the more you're going to protect other people and the more you're going to be protected from others as well. So I think that's really where the double mask comes in, is it's an extra added layer of protection, literally, but people also may find it hard to wear that. So I think it's important that people recognize that a single mask is still highly effective, but it just makes sense. If you have a second mask, it is just going to be that much more effective.
Okay, good recommendations, good guidance there. Again, lots of really great questions coming in. We have a question from someone asking if they've had COVID Should they wait 90 days to begin the vaccination process or begin right away when the vaccine is available? Can you help us better understand that?
Yeah, I think Dr. Frank mentioned that a little bit earlier too. I mean, you can wait up to 90 days because you do have some protection from infection. Since you had that already, there still is unknown how long that protection will last after having the natural infection. And some of the asks initially were that if you've had the infection, because of the low availability of vaccine, to give those other at high risk who haven't had COVID that priority in line. So that's where that 90 days came from, but there's no need to wait, especially if you have had it, you had severe disease and you have high risk, and you have availability to get it. It's probably better to get it sooner than later as that goes, because that will, again, build up your immunity and hopefully lengthen that protection for extended period of time.
Okay, great. We have just a few minutes left here with Dr. Cockley and Dr. Frank. Again, taking questions from our followers here. I do want to address, our process of how you will be informed when you are eligible to receive the vaccine. Again, I see lots of questions coming in. We understand that, people want to get the vaccine as soon as possible. Dr. Frank, can you again provide us for those guidelines of what people should be doing right now as they are waiting, and then what that process looks like for them?
Sure. So the single best thing to do for yourself or for a family member, if needed, is to sign up for my ThedaCare account. You can do that through our webpage, ThedaCare.org. Super easy to do. It's actually a great thing to have even regardless of the COVID vaccine, because you can have full access to your own medical records and be able to communicate with your healthcare team. But that is primarily how we are letting people know that they are eligible for the vaccine. We send an electronic order out, and you'll get an invitation to schedule that appointment. You can do your scheduling online. You can select the time and the date and the location that is best for you. And really it's very, very easy to do it that way. That also allows us, as Dr. Cockley mentioned, to give this vaccine to a lot of people, to really put those orders out to a lot of people without having to do individual phone calls. We are, for high-risk patients, often also doing some outreach based on their risk factors. Sometimes a patient may come into the clinic and we identify that they're at high risk and we placed an order, but I would say 95% of the time it's going to be through the MyChart.
Yeah, and along those, we are reaching out to those people that have higher risk based on their medical conditions, and age isn't one of those at risk. So proportionally a little more initially on that higher age group, and looking at, we have about 15,000 people that are 80 and above that are in that group. But some of them may be, healthier. So there may be a 70-year-old that's prioritized before an 80-year-old because they have COPD, lung disease, and diabetes, where the 80-year-old may just be 80 years old and have hypertension. So there's a little bit of risk stratification in there. We do have that in play, and we are trying to, again, get as many vaccines out as quick as possible to get you on the list and your vaccine as soon as possible.
Got it. Dr. Frank, again, last questions coming in here, but Dr. Frank, I want to get your thoughts. What do you want the community to do right now? Your patients, our community members who are following this, what are you asking right now?
I think first is just to make sure you're educating yourself as much as possible. There's a lot of great sites. The Department of Health Services through Wisconsin has an excellent vaccine update site. It gives you information on how many doses we've gotten, how many we've given out, as well as the current status of who's eligible, and then even links to where you can get vaccinations. I would get the vaccine anywhere you can. If it's at Walgreens, if it's at ThedaCare, if it's at the Fox Cities Convention Center. Again, it's all the same vaccine. It all goes into the same database. So would take advantage of whatever opportunities you have. And then I think continuing, I know it's so hard. I think we all struggle with this, but continuing with the masks and the hand washing and the social distancing, and the vaccine really gives us such a huge glimmer of hope, because we know that this is going to end. We know that this is going to end, and we know how it's going to end. It's going to end through vaccination and community immunity. So whatever you can do to help just hang in there until we have a fully vaccinated or mostly vaccinated community is going to be the very best thing you can do.
All right, and Dr. Cockley, my last question. What do you believe that the future holds for us? Dr. Frank touched on it a bit, but what are your thoughts for the future here, and where do we go?
Wow, that's a pretty big question. But I think it's continuing to get to that light at the end of the tunnel. We've been really cooped up and really changed our lives. I think each month goes by, spring comes, we're going to be able to take that next step to get back to more normal. Still have some modifications, whether it's limiting sizes of gatherings, still wearing our masks, and you're washing your hand. That hand sanitizer will probably be in the car forever, to use every time you get in and out. But I think that's there, and really keep, again, learning more, because we are learning as we go. So be ready to adapt as recommendations change, as we roll out more vaccines, new vaccines, and make sure you continue to keep up to date with your healthcare provider for all that news and information also. So be ready to adapt and get ready for our next phase and more social environment at some point in time here this summer.
Wonderful. Okay. Again, thank you very much for your participation today. We appreciate all the comments coming in. Our social team is monitoring those and will respond to those even after our Facebook Live ends. Dr. Frank, Dr. Cockley, thank you so much for your time and valuable information. We truly appreciate it. And thank you to everyone for watching.
Thanks.
Thank
Bye.
you.
Thank you.